Well, hey, everybody, this is Robert, and welcome to a new podcast. It's called Outbreak News Today, the newscast. And this will be short episodes on current infectious disease or outbreak news stories. But I still encourage you to check out Outbreak News Interviews, my other podcast, for discussions with experts in the field. Anyway, let's get to today's news. And one of the bigger stories so far in 2025 has been measles. There's no question about that. And because the United States has had a rough year with measles, well over 1,000 cases and at least 3 fatalities that I'm aware of, it's gotten a lot of extra attention. It's got more attention also because of the new administration and RFK Jr. and his issues with vaccines. However, looking north of the border, we see that Canada is really battling measles this year, and specifically the province of Ontario. Now, according to Public Health Ontario, from the beginning of the year through June 3rd, a total of 2,047 measles cases, of which almost 1,800 were confirmed, have been reported in the Canadian province. Now, in addition, there was one death that occurred in a congenital case of measles who was born preterm and had other underlying medical conditions. Now, Dr. Kieran Moore, he's the Chief Medical Officer of Health, issued the following statement. "It is with deep sadness that I confirm that an infant born prematurely and infected with measles has tragically passed away in southwestern Ontario. The infant contracted the virus before birth from their mother, who had not received the measles, mumps, and rubella, or the MMR vaccine. While measles may have been a contributing factor in both the premature birth and death, the infant also faced other serious medical complications unrelated to the virus." So to look at the outbreak that's going on in Ontario and put this into perspective, between 2013 and 2023, there were 101 confirmed cases of measles reported in Ontario. While just last year in 2024, there were 64 cases of measles reported. So clearly, this is leaps and bounds above anything the province of Ontario has seen in many years. Now, about 90% of the cases were unimmunized or underimmunized, while another 5% had an unknown immunization status. Half of the cases were reported in people ages 5 to 19. There was 140 cases that required hospitalization for their illness, and 9 people required intensive care. Now, in Canada, Ontario is not the only place battling measles, and some of the other provinces are getting hit pretty hard also. If we go west to Alberta, the measles transmission that's going on in Alberta is affecting individuals of all ages, infants, children, and adults. Most reported cases have been in children under 5 years old and those aged 5 to 17 who are not immunized. Cases have been reported in all zones of the province, with the highest numbers in the south and central zones. To date, Alberta has seen 778 total measles cases as of today. In Manitoba, health officials continue to monitor for measles cases and exposures that occur from these cases, and exposures from out of the province, travelers to Manitoba. To date, Manitoba has seen 90 confirmed cases and 4 probable. In Saskatchewan, from March 14th to June 4th, a total of 47 cases have been reported. And in addition to those are like the main provinces with the most cases. We're also seeing Quebec, 36 cases to date, British Columbia, 12, and then Prince Edward Island, 2. And we've also seen 1 each in Nova Scotia and the Northwest Territories. Now, measles is the most highly contagious disease characterized by a red blotchy rash. The measles virus spreads through close personal contact with an infected person and through the air when an infected person coughs or sneezes. The virus can be spread by droplets that can stay in the air for several hours. Infection with measles can result in serious illness and death. Well, that's the first news report from the Outbreak News Today, the newscast. And again, come back to see us, and there'll be news reports coming out on a regular basis. Again, my name is Robert Harriman, and thanks for listening.